Welcome back. Let's turn to my Get Real India story today. And it is the story of COVID orphans. Because remember, a number of families have been devastated by Corona 2.0. Officially, the virus has claimed more than 3.3 lakhs. Experts project that number much higher. Another statistic related to that is of orphaned children. That also runs at least officially into several hundreds. The government now says it will look after these children. But what's the ground reality? Take a look.
The Union Minister for Women and Child Welfare recently tweeted that in the period 1st April to 25th May, at least 577 children had become orphans. But this figure may not be the correct picture. It could be a significant underestimate, because not every COVID death was marked up as such on the death certificate. In Sehor, Madhya Pradesh, 12-year-old Ayushi and 7-year-old Alok are left with these framed images to remind them of their dead parents. Their mother, Chandabai, died in 2020. On 30th of April this year, the siblings lost their father, Anil Ahirwar. He had shown symptoms of COVID-19.
6-7-8 रोज बुखार आया, हम उसको इधर उधर अस्पताल में भी ले गए, अस्पताल में भी कुछ आराम लगा, तो हमने सोचा आराम लग जाएगा, आराम उसको लगा नहीं, फिर उसको बुखार आता था, तो हमने सोचा ठीक है अगल रहता था, फिर यहाँ आने के बाद में वो गले के मारे कोरोना में मरा, सर जी वो कोरोना में मर चुका.
Anil's death was not certified as a COVID death because he was never tested for the disease. His children are orphaned but not eligible for any government COVID relief scheme. Madhya Pradesh has many such schemes to help orphans who lost parents to coronavirus between March 1 and June 30 this year. Madhya Pradesh has recorded the highest number of children who have been orphaned by the coronavirus. Uttar Pradesh recorded the highest number of children who lost one parent. 1,830 children are now living in single-parent households after the death of a parent due to COVID-19. Bihar has the second highest number with 1,035 children in single-parent households. For those like 16-year-old Hanushesh Dheriya, a class 10 student in Bhopal, the expenses are piling up as he runs pillar to post to prove that his mother died because of the coronavirus. Her death certificate fails to mention it.
डेथ सर्टिफिकेट तो नहीं मिला, डेथ सर्टिफिकेट की एक पर्ची मिली है और वहाँ के जो सीएमओ हैं डॉक्टर ए के तिवारी, अब 20-22 दिन से ज़्यादा हो चुका, तो वो ये कह रहा है कि आप पहले सिद्ध कीजिए कि आपकी मम्मी कोरोना पॉजिटिव थी, क्योंकि वो 2 दिन तक कोविड वार्ड में भर्ती.
तो आप कैसे सिद्ध कर सकते हैं वहाँ पे?
सर हमने पहले ही सारी डॉक्यूमेंट जो हमारे एंटीजन की रिपोर्ट्स थी वो सब दे दिए थे, उसको देख के उन्होंने कोविड वार्ड में भर्ती किया था. अब वो हॉस्पिटल द्वारा मिस हो गई है और हॉस्पिटल अब हमसे ही रिपोर्ट मांग रहा है.
Despite what is happening on the ground, the Madhya Pradesh government, however, is claiming that every orphan child would get help.
देखिए हमारी सरकार ने ये योजना बनाई है, हमारी मंशा है, माननीय मुख्यमंत्री जी की मंशा है कि वो बच्चे जिनके सर से उनके माँ बाप का साया उठ गया है, उनकी मदद करना है. जब हमारी मंशा है तो फिर कहीं दिक्कत नहीं आएगी. निश्चित रूप से हर पात्र बच्चे को इसका लाभ मिलेगा.
Not just in Madhya Pradesh, but across the country, the number of COVID orphans dramatically increased after the second wave of infection. The National Commission for Protection of Child Rights on 1st of June told the Supreme Court that over 9,300 children have either lost their parents or have been abandoned since March 2020. And that number is bound to rise as the pandemic still rages across the country. Inputs filed by Hemendra Sharma in Bhopal for India Today TV.
So what is the way ahead for India's COVID orphans? Havovi Wadia is CEO Save the Children. Enakshi Ganguly is co-founder Haq Center for Children Rights. Thank you both very much for joining me on the show. Enakshi, want to understand from you that because of the discrepancies that seem to exist in government lists about those who've been rendered orphaned by COVID, how effective will government schemes be? Ministry of Child Development gives one figure, NCPCRI has another figure, state governments have have different figures. Is that a worry going ahead?
I just thank you very much for giving me this opportunity. I really wanted to do a little bit of a backstory for you and the viewers. The whole issue of orphans during COVID came up when there were these number of WhatsApp and other messages going around asking for children to be adopted because they had been orphaned. The idea was to understand that there is a kind of vulnerability that was happening, and therefore government was asked to respond. But given that, suddenly there's this narrative of COVID orphans came up, and every state government and the center jumped in. When you define somebody like COVID orphan, anyway, the terminology itself is problematic and stigmatizing. We didn't have tsunami orphans or super cyclone orphans. Orphans are whenever they happen before, they happen afterwards. And so when you drive them into a system, in a vertical system where everything depends on a piece of paper, what you are doing is actually designing it to fail, because thousands have died without any paper. That's the first. So that's coming to COVID orphans. Right. My friend Shanta Sinha always says the orphans are not created by the death of their parents. Orphans are created by the failure of the state. When the state fails to deliver to the vulnerable children, and children are becoming vulnerable not because only their parents are dying, they're becoming vulnerable because they're dropping out of school. So are we going to call them child labor, COVID child marriage, So how many more schemes are we going to have? So instead of having a schematic approach, what the government needs to do is understand that children are becoming vulnerable because of the situation of COVID, and universalize the kind of interventions and help that they want to give to these children, so that more and more children are covered and they do not fall out of the protection net.
So you're saying don't bureaucratize it. Don't reduce it to a piece of paper. Please prove to me through a certificate that you are, and I use that word COVID orphan, which you're saying don't stigmatize them. And that's a good point. I just call them orphans. Havovi Wadia, your view? Should the government go on the lines that they are, promising these various schemes for students, stipends after they are the age of 18? Do you believe that we can rely on a piece of paper where the death certificate must show both parents have died of COVID?
No, certainly not. I agree completely with what is being said. Children have been vulnerable since the start of the first wave last year, really. And it's only because of the entire social media hullabaloo that this entire term has come up, and we're now talking about it so much. But the crisis has been building up, and what's happened right now is that there is an event that we can talk about, which is the demise of both parents. But vulnerability is very rarely an event. It is a series of things piling up over a period of time, and we have to recognize that for children. About schemes, I think it's important that there are schemes. I think that children will need support. Kin will need support. So people who give care to children who have lost a single parent or both parents, they will need support. So they will need a certain amount of...
No, but how will that... May I ask both of you in conclusion, what will be your definition? Havovi, you first. How will you define who gets government benefits? How does the government also go about identifying those who need benefits?
I think it's quite easy. I mean, it's not easy. I think it can be done. There is a district child protection officer. That child protection officer can work with hospitals to start with, just to identify those who have lost their lives to COVID and those who are in the reproductive age group. Start with that, trace families from there. Parallelly work with Mohalla committees, with RWAs, with NGOs on the ground, get the data from the ground, reconcile it. It can be done because there are so many of us on the ground who are working with communities. Right. And so we can get more accurate numbers.
Interesting. So you're suggesting decentralized public-private partnerships right down to the district level to identify those who are vulnerable, as I will call them, as a result of COVID and need protection. Enakshi, are you on board on that? Should the government, therefore, rather than top-down, make it bottom-up?
And also not confine themselves only to children who have lost parents, because in the process there are in this process of what is happening with COVID, there are many more children who are going to become vulnerable, as vulnerable perhaps as those who have already lost their parents. Not to say that the losing of parents is not a horrible thing, and my heart goes out to them. But
Right.
you know, there is the spread it out, identify vulnerable children, reduce the vulnerabilities, create infrastructure. Our infrastructures are faltering, failing, and you don't need space. We also have the existing budgets. Why are they not being used? I
Right.
mean, why is it that suddenly PM Cares has to go for COVID orphans only? Is it that always we go for the low-hanging fruit? You know,
Okay.
and which sounds populistic and popular and tugs at our heartstrings. Talk about all vulnerable children and the ones who are going to become vulnerable.
I think
more
you
vulnerable in
raise
the
a very valid point. I hope someone in government, both at the center and states, is listening. We need to redefine how we classify our children who have suffered during COVID and need to perhaps change strategy. Thank you both very much for joining me. I hope that we can carry forward this debate in the weeks ahead.